All right, today we are going to crack open one of medicine's most common and most frustrating cold cases. We're talking about that nagging, chronic, low back pain that just doesn't go away, no matter what you try. If you're one of the millions searching for an answer, you know exactly how maddening this mystery can be.
It really does feel like a diagnostic mystery, doesn't it? You've seen the doctors, you've tried all the treatments, but that pain is still there. Well, that's often because the real source is hiding in a place that gets overlooked all the time. But we're about to shine a huge spotlight on that prime suspect. And get this suspect is responsible for a staggering number of cases. We're looking at research that shows anywhere from 15 to 30%. I mean, that's almost a third of all chronic low back pain doesn't originate in the spine at all. Nope. It comes from a joint most people have never even heard of, the sacroiliac joint, or for short, the SI joint. Okay, so to solve this mystery, first we've got to investigate the scene of the crime. Let's get to know this incredibly important but super misunderstood part of our own bodies. So the SI joint, it's not just any joint. It is the largest axial joint in your entire body. I want you to think of it like a critical bridge that connects your spine to your pelvis. Its main job? To take all the weight and all the force from your upper body and transfer it down to your legs every single time you stand up, take a step, or go for a run. So how in the world does it handle all that force? Well, it has this incredible network of ligaments. See these interosseous ligaments right in the center? They are literally the strongest ligaments in the entire body. They create something called a force closure mechanism, which is basically a super strong, stabilizing web that just clamps everything tightly together. Now, here's the thing. Unlike your knee or your elbow, the SI joint isn't built for a lot of movement. It is designed from the ground up for stability. It only allows for maybe a couple degrees of motion, these tiny little tilting movements called nutation and counternutation. Its number one job is to be a rock-solid foundation. That's it. This is the perfect way to think about it. The SI joint is the keystone of your pelvic arch. It's the piece that locks everything into place and acts as your body's main shock absorber, just soaking up the forces of daily life. That stability is absolutely essential. All right, so we've established it's this critical stabilizer, but what happens when that keystone starts to wobble? When it comes right down to it, SI joint dysfunction is a pretty simple movement problem. It's one of two things. Either there's too much movement, we call that hypermobility, where the ligaments get loose and the joint's unstable, or there's too little movement, which is hypomobility, where the joint just gets stuck and stiff. And both of those extremes can be a huge source of pain. So who's most at risk here? Well, the clues all point to things that create either instability or asymmetry. Think about pregnancy, for example. The body releases a hormone called relaxin to loosen ligaments, and that can lead to hypermobility. Or athletes in sports like golf, that one-sided repetitive twisting puts a ton of stress on the pelvis. Even something as small as a slight difference in your leg length can throw off your body's mechanics and put constant, uneven strain on that SI joint. And here's where things get really tricky. The symptoms of SI joint pain can feel exactly like other common back problems, like a herniated disc. So diagnosing it correctly, it's like a real detective story. It's this careful process of gathering all the clues and ruling out all the other suspects to finally pinpoint the real culprit. And this is basically the roadmap that clinicians follow. It always starts with just listening to the patient's story and doing a hands-on exam. Then they move on to some very specific physical tests, use imaging like an X-ray or MRI to rule out other problems, and finally, they confirm their suspicion with a very targeted injection. Now, this step is key to the whole investigation. These are called provocation tests. A clinician performs a whole series of specific movements that are designed to gently stress the SI joint. And if these tests bring on that familiar pain the patient always feels, well, that's a very, very strong clue. In fact, if 3 or more of these tests come back positive, the evidence is pointing heavily toward the SI joint. But the one single, most definitive clue, what's really considered the gold standard in this whole process, is a diagnostic injection. A doctor uses imaging to guide a needle directly into the SI joint and injects a numbing agent. If the patient's pain drops by 75% or more, bam, they found their culprit. The case is pretty much closed.
And for even more confirmation, some surgeons will turn to advanced imaging. A special scan called a SPECT CT can actually light up areas of increased bone activity. And as one surgeon in the source material put it, this can be the smoking gun that visually proves, yep, that joint is inflamed, and that's where the pain is coming from.
So once the SI joint is confirmed as the bad guy, the investigation turns to resolution. The whole focus now shifts to closing the case and finding a clear path to relief for the patient. The first line of defense is always going to be conservative management. This is a whole toolbox of things like physical therapy to strengthen those core muscles that support the pelvis, wearing a special pelvic belt for extra stability, or even using targeted injections or procedures like radiofrequency ablation to just calm down the inflammation and those screaming pain signals. For a lot of people, these steps are enough to get things back on track. But what if that isn't enough? What happens then? Well, the clinical guideline is pretty clear. If a patient has given it a good try for at least 6 months with that conservative care and it's just not working, and their pain is still significantly limiting their life, then it's time to start considering a more definitive solution.
And that solution is usually a minimally invasive SI joint fusion. The whole goal of this procedure is really straightforward: to get rid of that painful, abnormal motion by permanently stabilizing the joint. Surgeons use a few small implants to essentially lock the joint in place. And for the right patients, this has been shown to be incredibly effective at reducing pain and really improving their quality of life. And that really brings us right back to our central question. For the millions of people out there dealing with this unresolved chronic low back pain, maybe the answer isn't in the spine at all. It could be hiding in plain sight, and that powerful, stabilizing, and so often overlooked keystone of the pelvis.